Hello, everyone. My name is Mimi Krutine, and I'm the Student Services Counselor for the Community-Oriented Public Health Practice, also known as COPHP, Masters of Public Health program at the University of Washington in Seattle. Our MPH program is one of a handful of MPH programs in the Department of Health Systems and Population Health here on campus, so thank you for your interest in our degree. Welcome to the COPHP webinar. This presentation is roughly 1 hour and is aimed to introduce you to the mission and structure of COPHP and teach you how to apply for our degree. Know that you can always reach out to me if you have any questions or requests. We often open our classes for prospective student observation, and I'm always excited to make connections with current students or past COPHP students, teaching faculty, and program leaders. My email is right here. Feel free to reach out to me at any point in time if you have any questions or requests. I am the lady from application to graduation for this program, and I really love my job. So let's jump into the webinar. So COPHP is a very mission-driven program, so I want to start by reading our mission and goals to you all. The mission of COPHP is to prepare students to become problem solvers, advocates, and leaders in community health. We combine an active style of learning, and pair that with rigorous academic preparation and a commitment to social justice and community engagement. We are a 2-year full-time in-person program that equips graduates with the knowledge and skills to effectively address public health challenges. An important element I always like to touch on early on the webinar is the fact that COPHP's faculty, students, and curriculum have made a commitment to work towards becoming an anti-racist educational program. The University of Washington, the School of Public Health, and COPHP firmly believe that teaching public health through an anti-racist and anti-oppression lens is the only way forward. This isn't to say that we get it perfect every time, but this commitment holds us accountable to play a part in advancing towards true health equity. If you would like to learn about specific examples of the work we've done to align ourselves with this commitment, whether it's on a program, department, or school level, please feel free to email me. I'm always happy to share more details about the amazing work we do here at UW. So we're going to jump into a really common term in COPHP, which is learning objectives, which are COPHP's interpretation of the competencies that make our students masters of public health. Like like all other MPH programs in our department, COPHP is accredited by the Council for Public Health Education. And in order to be accredited, curriculums need to fulfill very specific competencies. This link takes you to those competencies. And these competencies essentially make you a master of public health. Now, COPHP's primary focus is always on application practice and how public health is actually performed in the real world. And in order to center ourselves in action, we have taken this long list of competencies and essentially massaged them into action statements. We call those action statements learning objectives. And we thread these learning objectives through all of your coursework, mentorship, research, experiential training opportunities, or service learning training opportunities. This slide is all to say we're an accredited MPH program, but we want to make sure that the work you're doing and the deliverables you produce during the program are not exclusively tied up in the theoretical space, rather a space of action and impact. These are some of the program's learning objectives that you can expect to master during your time in the program. I'll read a few of them out loud. So after you complete COPHP, you'll know how to assess community assets and needs. You'll engage and mobilize communities around public health challenges. You'll evaluate health programs and policies. You'll challenge the causes and effects of poverty and racism in our communities. You'll develop, implement, and manage public health programs, and you'll identify and address social structures and policies that create and perpetuate health disparities. You'll notice that these statements are very much based around what you'll be doing in as far as various public health work while being a student, furthermore rooting us in a place of action and practice. So let's zoom out a bit and go into more about the specifics of the program overall. COPHP cohort sizes are very small, ranging from 18 to 27 students, and we never exceed more than 27 students due to our problem-based learning structure. We are a cohort-based program, meaning you'll take all the courses in a specific order with your specific cohort for the entire 2 years. The COPHP program provides master's level training to be an effective and responsible public health practitioner. We often get asked what a public health practitioner is, and I like to describe the role as someone who ethically approaches communities, flips the microphone around, and asks community members what is working for them and what isn't serving them. Practitioners then use their privilege, power, and credentials to bolster what is working for these communities, to share power and embrace the wisdom and experience of that community. Public health practitioners also use those same three things, power, privilege, and credentials, to dismantle what isn't working for these communities. Practitioners are rooted in theory, but driven in action to improve community health. In order to start a program, you need a bachelor's degree, and the program strongly recommends applicants have roughly 2 years of work experience in public health by the time that they start in the program. The reason for this is due to our approach of problem-based learning, which is used in all of our core classes, where students draw from academic, professional, and personal experiences to inform the collective knowledge in the classroom. Although this is recommended, COPHP does practice holistic admissions and understands unpaid and lived experience is greatly important to your understanding of public health. We considered unpaid work as being equivalent to paid work, and have a question in our SOFIS application that says, would you like to provide any additional context to components of your application that may not clearly meet our recommendations? Feel free to use that question to address any public health experience that you have to make sure that we know that you're ready to jump into this unique degree. COPHP is unique in that it uses problem-based learning. We do not focus on lectures and assigned readings. Rather, we focus on a case-based approach. PBL or problem-based learning is an active learning environment, the opposite of lecture or didactic learning. This learning in problem-based learning is self-directed, and although faculty are present in the classroom, the students really facilitate their own learning. If you're unfamiliar with problem-based learning, I encourage you to do some research on it and see if it complements your personal learning style. I also encourage you to do a quick Google search on active learning and adult learning theory to understand the foundation of our pedagogical approaches. So what is problem-based learning look like for COPHP? We are one of a small handful, I believe only 2 other programs in the United States are using this pedagogy to teach our course content and also assess your understanding of the course material. As I mentioned, students take charge of their own learning, and the classroom setting is based on cases about real-world issues in public health, not traditional methods such as lectures, tests, and textbooks. There are a few exceptions to the no lectures, tests, and textbooks rule for COPHP, one course being our Analytic Methods course, where you learn to apply RStudio coding, a statistical software used for quantitative data analysis. This course includes a lecture element to assist our students in learning coding and is the only course in COPHP with exams as well. Instead of using these more traditional approaches to learning, such as lectures, tests, and textbooks, students work in small 7 to 10 person groups or problem-based learning sections to work through cases about public health issues, often written through the eyes of a public health practitioner. You'll work together in these small groups to analyze case or public health problems, define key learning points or objectives hidden within the case, and eventually explore solutions to the public health issue described in the case. Although your faculty instructor is in the room during problem-based learning, students are at the center of the class experience, and each case has a rotating student facilitator or pair of student facilitators that will guide their peers to the learning objectives hidden within the case itself. PBL or problem-based learning in COPHP is student-centered and team-based. Problem-based learning courses are 2 hours and 50 minutes long and meet twice a week, so students grow immensely in their facilitation and discussion skills during their 2 years in the program. Every case has multiple learning objectives weaved within them, and students work as a group to identify key questions that need to be addressed, not only to understand the public health problem described in the case better, but also go a step further and explore potential solutions. At the end of each class period, each student walks away with a single learning objective prompt, which becomes their homework for that class period. An example of a learning objective question or prompt a PBL team would synthesize in class to better understand the cases: describe effective practices for ethical data collection with communities. By the time students graduate, they will have met over 250 learning objectives by way of processing well over 50 cases. We'll get into more details about the problem-based learning class flow and structure in a few slides. And a reminder that we do open these classes up for prospective student observation so you can understand what the class experience looks like. So zooming out further, thinking about the program as a whole, know that COPHP is a generalist Masters of Public Health program. This means that rather than focusing on one specific area of public health, like global health, public health policy, for example, COPHP students learn broadly about all the pillars of public health, like epidemiology and biostats, policy, environmental health, social and behavioral sciences, evaluation, management, and more. That said, some students do choose to focus in specialized areas by concentrating their electives in a specific topic or by completing a certificate or specialization or concentration program in addition to COPHP's degree requirements. The most popular certificates our students choose are maternal and child health, disability studies, applied biostatistics, HIV and STIs, or the qualitative concentration. Many of these certificates do not come with additional costs, but do require some thoughtful course planning to meet both COPHP and certificate requirements. Some certificates, however, are self-sustaining, meaning they come with their own price tag on top of COPHP. I would estimate that 1 to 3 students per cohort take on a certificate. It is by no means required for our degree. As mentioned, the focus on COPHP is always real-world practice. So instead of completing a thesis which by nature kind of lives in theory, COPHP students complete both a practicum and a capstone project their first and second year respectively. Both projects are individual, time-intensive, immersive experiences with community-based agencies or organizations. The end product of these projects will be a deliverable that addresses a specific public health question or problem the site has, and it's intended to go directly into their public programming. We'll get more into these projects, we'll get more into practicum and capstone in a little bit, but these projects are extremely impactful and ensure our graduate students have multiple sources of real-world work experience managing high-level projects by the time that they graduate, which makes them extremely competitive in the workforce. COPHP is an in-person program, meaning we don't have hybrid or online courses. There are other MPH programs within our department that are completely online, so if you have a situation where learning at a distance is what you need, please explore those as COPHP isn't structured for virtual courses. Our program is 6 quarters long. The academic year spans the end of September to the beginning of June, and there are no classes during the summer between your first and second year, but you do have the option to take courses if you're interested. UW has a massive course catalog, and we always encourage students to take advantage of them. COPHP courses always take place between 9 a.m. and 5:30 p.m. during the weekdays. We're also a full-time program. I've never seen the case of a student be able to work full-time and complete our program simultaneously, but many of our students do work part-time or less during their 2 years with us. We've been able to calculate and poll our students to determine how much time they actually spend specifically for COPHP coursework. The UW Graduate School calculates for every 1 credit graduate course, you can expect to complete 3 to 4 hours per week outside of that class period on that course's materials. And because our problem-based learning courses are all 6 credits, we can say confidently that you can expect to commit anywhere from 18 to 24 hours outside of class per week specifically for problem-based learning assignments. Courses are provided in a specific order and cannot be taken out of order or outside of your cohort without special approval. These bullet points essentially outline what your transcript will look like when you're done with our degree. 36 credits of core courses or those problem-based learning courses spread over the 2 years, 6 credits each. There's 1 credit of COPHP seminar per quarter. COPHP students take 2 credits of practicum, that big culminating project for your first year, each quarter of that first year. And then there's 9 credits of capstone, which is the culminating project for your second year, usually 3 credits per quarter. And then we only require 6 credits of electives total to graduate from our degree because we know our program is rigorous, but you can totally take more if you'd like. We also don't gatekeep electives and want you to take advantage of UW's impressive graduate course catalog. It doesn't matter if you find a graduate course in the School of Public Policy, Medicine, Education, Social Work, or others, as long as it's a 500 level course or above and the instructor hasn't put restrictions on it, you belong there. Our students have a very diverse set of expertise and interests. We want you to grow spherically while you're at UW. You're free to specialize or diversify however much you want within our academic program. So thinking about the required first year courses in COPHP, here is a link at the top with all of our course summaries so you can learn more about what each course really focuses on. I encourage you to check that out. Your probably learning course for autumn quarter, your first year, is population health and community development, 2 very different courses in the span of a 10-week period. Every time that you're in COPHP, or every quarter you're in COPHP, you'll always have that COPHP seminar where your entire cohort will get together weekly and learn from content experts that are invited to essentially ground the cases you're working through in problem-based learning to current sites, projects, job titles, and people working within that case's materials. For winter quarter, your problem-based learning course is analytic methods, where you learn how to code in RStudio, interpret complex public data sources, and generate reports and conclusions. You are not required to come into COPHP with any previous coding experience. We are so excited to teach you this transferable skill. Spring quarter problem-based learning is health behavior and promotion, as well as environmental health. Again, 2 courses in the span of 10 weeks. And then the first years take practicum for their service learning or experiential learning opportunity. And this amounts to 160 hours of students attending a site or community-based agency or organization working towards completing a deliverable that addresses a specific question or problem the site has related to public health. You take 2 credits every single quarter your first year in COPHP. These practicum deliverables kind of span a lot of different approaches. They can include needs assessment, curriculum designs, evaluations, or even peer-reviewed publications. Similar to an internship or an apprenticeship, practicum roughly amounts to 160 hours of site work, and you spend time at the site between winter and spring quarter. So this is the visual schedule of the first year in COPHP. Again, UW is on the quarter system, so the columns here are autumn, winter, and spring. Feel free to ignore the year on these. They're just for representation. This big blue class right here, kind of captured in all quarters, is that problem-based learning class. It'll meet twice a week for 2 hours and 50 minutes, just short of 3 hours. And as you can appreciate, we have 3 sections of problem-based learning per course, which allows us to have very, very small class sizes, pretty much unparalleled class sizes in comparison to other much larger MPH programs. You're not going to have a problem-based learning class with more than 10 students at any point in time. These section assignments are also mixed up each quarter to ensure that by the time you graduate, you will have been in a problem-based learning class with every student in your cohort. First year problem-based learning courses meet on Tuesdays and Fridays, while second year problem-based learning courses meet on Mondays and Thursdays. The course's team of instructors, for example, in the course Population Health, you'll see this team of instructors, Haley, Kendra, and Barbara, and they essentially lead the course experience. They get together well before the class starts to write cases that target that course's specific learning objectives to guide students to the competencies for that specific course. Each problem-based learning section processes the same case during their class period, but some differences include the community-based organizations students work with on culminating projects, as well as the instructors and students in the class section themselves. These project connections are facilitated by the faculty experts network and often change year to year. This orange class right here is your problem-based learning seminar, where your entire cohort will meet once a week for about 80 minutes to hear from visiting speakers who have expertise in the case you're working through in problem-based learning, and essentially help ground the case to current sites, projects, and job titles to deepen your understanding and increase your public health network. This class doesn't have assignments, but often proves very valuable to connect students with potential sites, projects, and advisor for capstone and practicum projects, and avenues for the next stages of their career. This final green class at the bottom is practicum. Jasani Henry has been our practicum director forever. He was in the first graduating class of COPHP, and roughly a quarter of our faculty are alumni of our program as well. In conjunction with his position as COPHP's practicum director, he also works full-time for Public Health Seattle King County. And Jasani spends his entire year with us shepherding current students through their practicum projects, but he also uses this amazing network to identify impactful and directive projects for incoming students so that when you first start your autumn quarter in COPHP, he presents your entire cohort a list of many projects, often more projects than we have students. This year we have 50% more projects than students. And in that pitch, he'll have a clear deliverable, a site supervisor who will be essentially your day-to-day manager to make sure you have a point of contact on there, and then the process in by which you reach that deliverable. Jasani flips the classroom during autumn quarter to have all these sites pitch the projects to your cohort. He also meets with you individually to get a sense of your short and long-term goals. And by the end of autumn quarter, students rank their most desired projects and are placed in them before winter quarter starts, so that when winter quarter does start, you start attending the site to work towards that deliverable instead of meeting as a cohort for class. You also have agency within practicum as well. So if you come into COPHP with a clear idea of a site you want to work with, a person working there that can supervise you, and a defined project process and deliverable, I'm always happy to introduce students to Jasani during the summer before you start to ensure the project meets the expectations of COPHP, is doable on 160 hours on an academic timeline, and that you're supported on all sides. At the end of practicum, you will hand off your deliverable to the site, give a presentation there, and give a presentation at UW, and you'll be a second-year student. I also want to note that COPHP's practicum process is quite different from other larger MPH programs at UW, where students are essentially tasked with sourcing their own practicum project from the ground up, while they are also calibrating to their MPH program and potentially Seattle. COPHP's highly curricularized practicum experience is one of the many intentional elements of the program that helps prepare our students to hit the ground running and execute high-level projects with transformational deliverables. For both experiential learning projects like practicum and capstone, you'll have a faculty advisor to be a helpful point of contact on the UW side, and a site supervisor who will act as your day-to-day manager at the site to make sure your deliverable meets the agency's needs. Practicum and capstone projects are intended to help you build those transferable skills, widen your public health network, influence public health program, build relationships with community, and flex your strategic thinking muscles to prepare you for the next stage of your career. So let's talk about what a week in the life of a COPHP student looks like when it comes to problem-based learning specifically. In terms of the day-to-day rhythm of problem-based learning, here is a good infographic of what to expect. As I mentioned, your class for problem-based learning meets twice per week. For your first year in COPHP, those classes fall on Tuesdays and Fridays. In the example of Tuesday's class, COPHP problem-based learning always starts off with an icebreaker crafted by the rotating student facilitator or pair of student facilitators. As briefly mentioned before, our instructors are present for the entire class meetings, but don't facilitate the PBL courses themselves. Although each problem-based learning course and instructor is different, I frequently equate the role of a faculty in problem-based learning to kind of bumpers on a bowling alley. COPHP faculty provide a structured and safe environment for students to work as a team to complete their task for that class period, which is processing the case and identifying the learning objectives hidden within that case. At the end of each problem-based learning class period, each student walks away with a single learning objective to research and package into a report to teach the answer to your peers. Problem-based learning for COPHP is a group learning space where your peers learn from you and you learn from them. So when you get into class that first problem-based learning meeting, those rotating student facilitators will have already met with the course instructor before that class period to discuss the hidden learning objectives within the case and brainstorm facilitation ideas. All PBL classes start with an icebreaker crafted by that student facilitator. Sometimes it's funny, sometimes it has to do with the case, but once everyone thaws out, that group of student facilitators will distribute a printout or an electronic copy of a case about a public health issue, often written through the perspective of a public health practitioner. You will all first read the case together aloud, then you are given time to read the case individually. During this time, you'll view the problem described in the case through the lens that you've curated from your experience in public health. Whether you pull from personal, professional, or academic experience, you'll start to identify things you know to be true about the case based off of your experience. And you'll start to track and list those truths in your notes to share with your peers later in the class period. As you identify things you know to be true, you'll also start to synthesize questions that need to be addressed for you to either understand the case or problem better, or potentially explore solutions to the problem. This highlights the importance of having experience in public health when you start in the program. Our cohorts are really diverse in their background, experience, and passions, and we find that when all these brilliant minds get together in a room, they can think about problems from a solution-driven perspective and want to learn deeply from each other. So after you're done individually processing and you've written down your things I know to be true and things I maybe don't know just yet, you'll come up for air and start to engage in a discussion about the case in your small group. This is where students all share the things that they know to be true, essentially building up the collective knowledge about the problem at that point. As a team, during that discussion, you'll also start to identify anywhere from 7 to 10 questions that you all agree would help either deepen your understanding of the case or lead you to a potential solution to the problem. At the end of each class period, everyone walks away with one question or learning objective prompt that becomes your homework assignment for that day. These action items are those learning objectives we touched on at the beginning of the presentation. An example of a question you'll be asked to address in problem-based learning as a homework assignment would be, describe effective practices for ethical data collection with communities, or what are some systematic differences between accessing healthcare in Seattle versus 3 hours away in Vancouver, Canada. The most common type of assignment you'll do in COPHP to address your learning objective is a 5-page research paper. And once you have completed all your research to address your homework question, and you've packaged it into typically that 5-page report, you'll upload that research paper onto Canvas, which is our online learning tool. And you'll upload that the evening before your next class period, typically at a time determined by the students and the faculty in that section. For example, you'll see on this rhythm example, you'll see Thursday right around 6 p.m. After you upload your paper or assignment, you are required to read everyone in your problem-based learning section's paper or assignments. These assignments essentially become the textbook that you and everyone in your problem-based learning section writes for the course. COPHP students learn by consuming research in many forms to allow for effective communications to teach their peers. The accountability to your peers in COPHP really can't be understated, as you're only given 2 to 3 days to produce that assignment. And you are effectively in charge of teaching your peers elements of the course. We know this pedagogy isn't for everybody, and that's totally okay. But if you learn by doing, thrive in teams, and want the opportunity to be at the center of your own educational experience, this is absolutely a great program option for you. We also have your faculty instructor in the room prepared to clarify, reframe, redirect, and ensure the class moves forward each class period, keeping in mind those learning objectives and competencies. For that next class period, so in this week you see Friday, after your icebreaker, your section will actually undergo a debrief where your section may split up into smaller groups or even do a big group discussion to discuss the learning objective reports or assignments submitting the evening prior. This debrief can be an open forum to resolve any remaining questions, allow for respectful feedback, or where you can share resources that proved helpful. Once the debrief is done, your problem-based learning section will move on to the next layer or day of the case. For example, on this Friday, you see case 1, day 2. Sometimes our cases are built like upside down triangles where you start off really high in surface layer level, and then each layer or day you dig down deeper to the problem's foundation that's causing the larger disparity. Other times our cases are more shallow and you'll move from one case topic to another each class period. But this is the weekly rhythm for every problem-based learning class. It's icebreaker, case analysis, identify the questions needing to be addressed, going off to do research to address those questions, teaching your peers, having them teach you, and then you all move on to the next layer or the next problem. This is the rhythm, this is the wheel for your entire 2 years with us. Like I said, the most popular type of assignment for COPHP is a 5-page research paper where you'll condense your findings, analysis, critiques, synthesis, and reflections for your learning objective prompt. But one of the big goals of COPHP is teaching students the skills necessary to reach their specific audience. So you'll learn different strategies to convey public health concepts such as infographics, social media campaigns, policy brief, lightning talks, community meetings, and even possibly public health curriculum for high schoolers. We want you to be able to do it all by the time you leave. Additionally, I've heard of past COPHP students when there isn't a firm guidance on the structure of the learning objective assignment is they actually addressed all of their homework through graphic novels. Again, you're tasked with teaching your peers your content and they're tasked with teaching you. So we encourage our students who are at the center of our degree to really flex those muscles of building all of those transferable skills of reaching your audience, knowing that most of the time your audience are your peers. So going back to the first year visual course schedules, some COPHP classes actually bake in group projects where you'll work with community-based agencies or organizations on a deliverable that addresses a public health question or problem that they have. The best course that really highlights this opportunity during your first year in COPHP is the second course you'll take in our degree, which is community development. This class involves an immersive site partner project in a rural area of Washington State, where the program pays for your entire problem-based learning section to travel to that site, that rural area of Washington State, and complete a week of field work within community. Like I said, this experience is fully funded by COPHP, including incentives to our community. There's no additional cost to students. Note that we also open our course's final presentations for prospective student observation. This was just happened yesterday, and I'm always happy to share the amazing deliverables that our current first-year students submitted for their community development projects. Students went to Forks, Washington, Island County in Whigby and Camino Island, as well as Wenatchee in Central Washington this year, and all of their deliverables were stellar. These community development course, as well as others within our degree, allow for our students to be strategic and actually execute change and provide recommendations to these sites for aligning themselves better with their goals to really embrace that student-centered and agency that our students are provided within our courses. Reach out to me if you ever want to learn more about community development. It is an amazing course. So moving on to second year courses for COPHP, your autumn quarter class will be health policy. That's for problem-based learning, and this class sometimes involves site partnership. Past partnerships have included the Washington State Environmental Justice Council, REACH, which is an amazing organization near the University of Washington campus working with unhoused youth, as well as farm worker advocacy groups in Central Washington. Winter quarter is for second year in COPHP is participatory evaluation and community engagement, where your entire 10 weeks will be spent designing and implementing an evaluation plan with a site partner. Each year I've attended the students' final presentations for this course. The sites have actually attended and actually implemented and adopted more than half of the students' recommendations before the end of the quarter. Again, this fact highlights how COPHP provides avenues for students to influence change in communities, sharpen that strategic thinking muscle, and then also allow for super deep learning. By the time you're done in COPHP, you will have anywhere from 4 to 5 different external opportunities to build relationships with sites and bring ideas to reality. Spring quarter for problem-based learning in year 2 is management and leadership. This final quarter is very reflective and gets you ready for the next stage of your career by analyzing cases around managing public health projects and leading programs. You'll have multiple professional development workshops during this quarter as well to help springboard you into the next stage of your career. Lastly, just like you have a COPHP seminar your first year, you'll always have that each quarter your second year, where public health practitioners and content experts will come and reinforce the information that you're learning in PBL with current sites, projects, and job titles working on similar problems. The culminating project for year 2 in COPHP is Capstone, which is 9 total credits. Capstone is a year-long project that you create from the ground up that amounts to 360 hours of work at a site of your choosing, working on a deliverable to address a specific public health question or problem. Students can specialize in an area by building off their practicum projects or diversify their connections and skills and work with a different organization, community, or method to reach that deliverable. Students build their support teams for this project by choosing a faculty advisor and a site supervisor. We also have an amazing capstone director, Jenya Shimkin, who is another alum of the program and actually still runs her capstone project as a nonprofit to this day. Students also complete a contract proposal and literature review early in the capstone process and have checkpoints throughout the year to make sure they're on track for this really important work. By the end of those 360 hours, second year students hand off their deliverable to the site, present their capstone projects at that site and UW, and go off and graduate and change their communities for the better. As I mentioned before, there is an option to specialize within our generalist degree. You can do this in a couple different ways. First is by completing a graduate certificate on top of our degree. There are so many certificates at UW. If you follow this link, there's a lot of popular ones. This isn't an exhaustive list. However, feel free to reach out if you have any specific interests, and we can look through the certificates together, as they're pretty spread out. The most popular ones with our students don't have an additional cost associated to the certificate. It just takes some careful course planning to fit in 12 to 15 of additional coursework, 12 to 15 credits of additional coursework over those 2 years. Alternatively, you can choose to concentrate your electives in one area of study. For example, this link takes you to a whole bunch of environmental health courses offered by our school. It's also possible to earn a dual degree while in COPHP. We have 2 concurrent degree options where you complete your MPH in COPHP and a Master's of Social Work or a Master's of Urban Planning at the same time. If you are considering this route, I strongly encourage you to reach out to me to talk through this 3-year timeline. We'll go over course plans, cost implications, and all the details associated to dual degree support and advising. Keep in mind, we are no longer accepting clinical track MSW applicants due to really restrictive policies put in place by the graduate school that doesn't allow for this combination of degrees to be completed in 3 years like the other dual degree options I mentioned. So thinking about admissions, applications to join our 2025 entry cohort are currently open, and they'll close on January 15th, just in about 6 weeks. Decisions are typically conveyed in mid-February, right around Valentine's Day, and decisions are due by April 15th, 2025. You can always apply to multiple programs within our school, but keep in mind our application deadline could be different than other School of Public Health MPH programs. If you're unable to submit that application by January 15th, but still want to be considered for our next cohort, please reach out to me via email. We may be able to review your application after the deadline if there's still space in the cohort. So thinking about how to apply, COPHP has 2 applications that you must complete for entry, and I'm so sorry for that. These 2 applications are separate and essentially collect different pieces of information. SOFIS is where we collect your transcripts, essays, letters of recommendation, and more, while the UW graduate school application essentially creates a shell for your student record so that if you're accepted, that will become your formal student record. Decisions, so accept, decline, or waitlist, those decisions will actually be issued through the graduate school application portal, not in SOFIS. So please do complete both for consideration. So as I stated before, we do require that you have a bachelor's degree from an accredited college or university in the US or its equivalent from an international institution. Additionally, students whose first language is not English must indicate English language proficiency before they start in our program, which you can follow this, follow this link to learn more about that and the other minimum entry requirements. The graduate school prefers a minimum of a 3.0 GPA on a 4.0 scale. But again, we have a question in our SOFIS application where you can provide context to any elements of your application that may not clearly meet our preferences or recommendations. For example, if your car broke down on the way to your biostats final, like mine did, you can say, this grade isn't representative of my understanding of the content. I've done X, Y, and Z to increase my readiness for this element of our requirements or anything like that. Feel free to use that question freely and know that we take it in consideration when applying our holistic admission framework. So additionally, lastly, we strongly encourage 2 years of post-college work experience in public health by the time that you start in the program, but note we count unpaid work as equivalent to paid work, and we do occasionally accept applicants directly out of undergrad if they can demonstrate sufficient public health experience and or immersive work with communities during their time in undergrad. This requirement stems from that problem-based learning pedagogy where the class experience is largely informed by the knowledge already existing in the room. And we want to make sure that each student understands they need to contribute as much as they extract within that learning space. Again, we are so excited to teach you and we don't expect you to learn it all, but we do need to be considerate of this unique learning approach to make sure that the problem-based learning space is productive and equitable. So thinking about required application materials, here you can see the full list of what we require, but note that our admissions website down here fully outlines all the required elements of both of our applications, so I encourage you to bookmark it. So in order to be considered for entry, you need to submit both a SOFIS and a UW graduate school application. You'll submit transcripts where you took courses, and that'll all be done in SOFIS. Note that we have a transcript bypass option outlined on our website where, pardon me, where you do not need to submit or enter every single course you've taken since middle school in SOFIS. But keep in mind, this option is only available to applicants only applying to programs in the Department of Health Systems and Population Health at UW, since transcripts and course lists are shared across all the programs you apply to in SOFIS, and we don't want to sabotage your applications to other programs if they really require that information. So that bypass option is at the very, very bottom of our admissions page. Feel free to look at it. Know that if you do use the transcript bypass option, SOFIS will most likely reach out to you via email because they want you to do everything that they require. But us as a program are totally happy with just receiving your unofficial transcripts in lieu of your official transcripts and really detailed course lists. You'll also upload your resume or CV in SOFIS. I always encourage applicants to be really inclusive. Feel free to include volunteering, internships, conferences, mentorship, anything you can think of that would increase our admissions committee's confidence that you're ready to jump into our unique degree with both feet. You'll also submit 3 letters of recommendations in SOFIS. And we ask that one of those three recommenders be an academic reference that can speak to your experience in a classroom setting. Sometimes when we get 3 letters of recommendation from your employers, we know you're a solid employee, but being a student is really different. And we need that perspective to assess your readiness. And then this second to last bullet point, a public health problem statement is going to be submitted in SOPHIS. That's one of our most important essays, where we ask you to discuss a public health problem that you're passionate about and how you see yourself contributing to a solution while you're a student. Keep in mind, there's no right or wrong answer to this prompt. It's designed to pilot the hopefully very real situation of if you were in a problem-based learning class and your student facilitator handed you a case about a public health problem that you know a lot about and you care a lot about, how would you start to unpack that with the students in your problem-based learning section? What inspires you about this problem? What frameworks and policies influence the problem? How would you approach solutions, or how have others approached solutions? We also have an optional question for references related to this prompt. Since we're really big fans of citational justice, feel free to use whatever citation format that is going to work best for you in the character limit allowed, and reach out to me if you have any questions. Lastly, TOEFL or EILTS scores are submitted if you, in order for our English language proficiency requirement, but feel free to reach out if you have any questions about it. This is one of my favorite slides in the deck because it's free money. There are application fee waivers available for both the SOPHIS and graduate school applications. Typically, SOPHIS just ran out as of December 1st, but there are still ways to waive the cost of your UW graduate school application, which is $90. This first graduate school application fee waiver policy can be used if you're a McNair or PIPA fellow, and importantly, if you have financial need. Financial need does not require documentation, and you can request this waiver by just checking the box directly in your UW graduate school application. The second waiver option right here, the MPH fee waiver policy, states that if you've been associated with any of these organizations or others, we will actually go in as a department and pay your application fee for you. However, note that if you are pursuing a waiver, you need to submit that waiver about 5 to 7 days before you submit that application. And please do not submit your application before you receive confirmation by email that it's been paid, as we can't reimburse you after you've submitted that application. There are 2 main things our admissions committee is looking for in your admission or in your application materials. One is we want you to articulate how the program's unique attributes align with your learning style and career goals. We appreciate that problem-based learning is weird and different and unique, and it's definitely not for everybody. But if you learn by doing things, if you love working in teams, if you want to be at the center of your degree experience, if you want to have the agency to learn avenues or public health content that is maybe on the fringes, this is an excellent program to really lean into all of that. We are always guided by competencies and learning objectives, but our students have the liberty to really explore content that isn't necessarily laid out in that handbook. So it's a great opportunity. It's all by intentional design, but it is very different from traditional learning. So if you thrive in the back of a giant 150-person lecture hall, if you love Scantron tests, COPHP is probably not the best fit, but there are so many amazing programs out there included in our department that really cater to that traditional learning style. Second is we want to learn about your academic and work and life experiences and how they've prepared you to be successful in a demanding and rigorous program. We firmly believe that all work is related to public health, but we want to see how these experiences have informed your passions and vice versa, how your passions have been informed by your experience. So thinking about the cost of our program, it's important to first note there are 2 funding structures for graduate education at UW because it's a public institution. One is tuition, where the amount that you pay is dependent on your residency to Washington State. Washington State residents pay less tuition because UW is a public institution, while out-of-state students pay roughly twice the cost of in-state tuition per credit. So that is tuition-based funding model. COPHP is the other funding model, which is a fee-based program, which means we are a flat rate for every single student, regardless if you're a Washington State resident, if you're coming from out of state, if you're coming from out of the country, or even if you're undocumented. So it's a flat rate for all students. This is the cost per quarter if you were to start this year with us in our degree, and this is the estimated cost of our degree. How this compares to the tuition-based program in our MPH program in our same department is that we are right in between in-state tuition and out-of-state tuition, meaning we are slightly more expensive if you're a Washington State resident and comparing us to a tuition-based program, and also slightly more affordable if you're coming from out of state. COPHP is always open to exploring ways to reduce the cost of our education. We constantly explore funding awards and other partnerships that can provide funding to our students. However, every program is required to increase their course fees or tuition roughly 2%. So you can calculate that for next year. Additionally, this added cost or increased cost, we really try to offset by the amazing experiences and opportunities provided within our core classes, and also understanding that the instructor to student ratio at COPHP is unparalleled. You get one faculty for every roughly 10 students, and that is absolutely by design. Students in fee-based programs receive all the same perks as tuition-based students, such as a U-Pass that covers all public transit across Seattle within your quarterly costs. This reaches some ferries. I take a ferry into work and UW covers it, all of the buses, and as well as the light rail, which is essentially Seattle's subway system. We do, as I had mentioned, we do encourage students or applicants to explore external funding awards, but know that federal financial aid is available and works with COPHP, and there are a handful of funding awards available. You just have to check a few boxes in our application to be considered, and then we'll also make sure that we advertise other funding awards hosted by our school after the application period closes, so you can be aware of these really impressive awards, as our students are really well known across the school. Another attractive, for example, COPHP students were awarded over $95,000 in funding awards last year. Keep in mind, we kind of take the Mean Girls tiara approach when it comes to our funding awards, meaning we break it up, this large amount, into smaller pieces to support as many students as possible, opposed to providing a single student with a full ride. Another attractive approach our students have used to reduce the cost of their education is through student employment. COPHP students are eligible for work study, and UW has 3 different types of student assistantships that our students apply for. The 3 types are teaching, research, and administrative assistantships, or staff assistantships. So sorry. You can be employed by any school or department at UW, and these positions come in all different capacities, anywhere from 2 hours a week to 20 hours a week. And those 20-hour-a-week positions specifically come with some amazing perks. Before I jump into that, I do want to remind you all that we are a full-time program, and a 20-hour-a-week position is a huge commitment. However, COPHP students do have the highest percent of assistantships across all MPH programs in our school, which really speaks to their competitive nature and their ability to do research, teaching, and administrative tasks very, very well. So those 20-hour-a-week assistantships that are quite competitive to obtain, we don't place you in these, but they come with some amazing perks. One is hourly or salary pay, depending on how the position is written. Second is benefits, which includes medical, dental, vision, and pharmacy. As well as lastly, those 20-hour-a-week assistantships secure those employees a course fee waiver, where your hiring unit will actually cover 90 to 95% of your course fees during the quarters you're employed with them. And again, we are a full-time program and we don't place you in these positions, but given the fact that our students are very competitive for these positions, and they can apply outside of the School of Public Health in various different sectors, whether it's related to language, research, clinical work, anything in between. They are great opportunities to reduce the cost of our education. However, the amount of positions we're seeing at UW are kind of going through this pullback. UW assistantships are all fully unionized, which provides amazing protections and negotiations and support for those in those positions. However, they just went through a big transformation this past summer that increased their pay, coverage, and leave options, which are fantastic. But due to that increased pay, we're seeing a slight downtick in the amount of assistantships offered at that 20 hours per week rate. So just keep in mind they are competitive, but the fact that you can apply all over the university really does increase your chances. Feel free to explore our cost and aid web page for more information about the cost of our degree, and let me know if you have any questions. So our communications team is currently working to update our alumni report to capture what our alumni are doing post-pandemic, but here are some general statistics about our amazing alumni, and feel free to check out this website in the top to learn more stories. 99% of our alumni are working full-time, and 100% of those are in public health. We have alumni representation across 29 states and 8 countries, and 37% work outside of Washington state, meaning you aren't tethered to working in Washington state or even in urban areas when you leave COPHP. We intend to teach you all of the transferable skills so you can go off and do amazing work with any community that you hold dear. Across the various sectors of public health, our alumni are most represented in the community organizations, then government, schools, university, research, healthcare, some private sector, and even some self-employed. Again, you can read more about our specific alumni through the link at the top, but know that our degree pairs you for working in tons of different areas and tons of different sectors of public health. I'm always happy to connect you with some alumni so you can learn more about their perspective. If you have a dream job or a dream job site, let me know and we might have an alumni working there. So thinking about why COPHP, out of all the potential degree experiences you could have for your MPH, here are some reasons why you could want to choose COPHP. We, again, are one of a small handful of MPH programs in the country using a problem-based learning format to deliver an MPH degree. This pedagogy is very different from the traditional learning environment and comes with high accountability and a quick turnaround, but we have intentionally built out our degree so students become very comfortable working through problems in teams, and this models the types of working groups you'll have in your long-term profession of being strategic, executing, influencing all of the major elements of public health work. Second, our faculty are amazing. The majority of our faculty are not full-time professors. Rather, they are public health leaders across many organizations at various local, state, and federal levels who have a deep understanding of current issues impacting communities right now. And they have well-forged connections with these communities as they do it in their full-time work. So our students are essentially able to work through that well-defined avenue to make sure that the projects they work for, that these communities are supported well before they get there and well after they leave. As I mentioned Jasani as an example earlier in the presentation, but many of our faculty have full-time positions external to UW, and they bring all that wisdom, connections, and perspective of current public health problems communities are facing into the classroom for the course that they teach. Sometimes this means it's kind of hard to get in touch with them when they're not actively teaching because they are out changing the world, but we find the pros far outweigh the cons on this point, and we're still able to maintain strong mentorship agreements for both years in our degree. Lastly, or second to last, UW School of Public Health was ranked among the top 10 public health graduate schools in the country last year. I believe we were ranked number 5. Lastly, UW has been named the most innovative public university in the world. I always hesitate amplifying sensationalized review, but something I can say with complete confidence is it's really nice being in a small program in a big school. You're given all the community support of something small, but all of the resources and impact of a giant institution. So it can be the best of both worlds. Seattle is the largest city in the Pacific Northwest and is a great place to do public health work. Please reach out to us if you're in the area. We'd love to invite you into our classrooms, meet with current students and faculty, and learn more about what your life would be here as a student. A reminder again that our problem-based learning courses are open for observation. Feel free to register to observe a class or the students' final presentations to see what you'd be doing in our degree. Lastly, we also provide small travel stipends to accepted applicants during the decision period between February and April 15th. So if invited, please do apply for those funds early because they can run out really fast. And we'd love to have you here in Seattle to see if our degree is right for you. So if you're interested and thinking about next steps, you can always email me right up here. Again, I'm the lady from application to graduation for this program, and I love my job. This program, the people in it, and the students really make it what it is. So let me know if you want to be connected with anybody. Please do set up an individual meeting with me if you're thinking about a dual degree where you're combining COPHP MPH with urban planning or social work, as this process is super involved. In that one-on-one meeting, we'll discuss the 3-year course plan, how to make the most out of it, and also calculate an estimated cost for completing both degrees based off of your individual situation. Lastly, if you're interested in COPHP, please do sign up for our admissions newsletter or start an application and let me know how I can support you from start to finish. And lastly, here's our home website, here's my email, here's a secondary contact if you need any application support. This is run by one of our amazing communications team points, Lauren. And this concludes the presentation. Thank you so much for your time and energy, and I hope you have a great day. Thank you for considering an MPH where you solve the world's problems. It's very much needed, and I hope life treats you well. Have a good day. Bye.